All righty, let's go ahead and get started. And I'd like to begin just by saying that on behalf of all of our UNM Health and Health Sciences Office for Diversity, Equity, and Inclusion, we really want to thank you all for taking time to join us. And just to let everyone know that the presentation will be recorded and then posted on the website for people who could not join us today. So first and foremost, welcome to our celebration of Asian American Pacific Islander Heritage Month, AAPI Heritage Month. And we're really honoring the contributions, invaluable contributions of our AAPI community members, both throughout history and currently, and just recognizing the resilience, leadership, and achievements of our AIP community members. So particularly also in healthcare, right, where our AAPI members have long been at the forefront, as caregivers, researchers, scientists, innovators, just really crucial for us to be highlighting their pivotal roles in shaping the present and the future of health and healthcare today. So we're excited to be here and honoring three amazing leaders in the health and health sciences. And just to remind people too, in case you weren't aware, but the theme of the National Heritage Month in 2024 right now is Advancing Leaders Through Innovation. So there's no better time to celebrate these outstanding, diverse awardees right here at UNMHSC, and really to acknowledge and thank them for their work that truly embodies the strength and the resilience and the legacy and those who have come before, but also the work that they have been doing now for quite a while. And it really speaks to enhancing the vision that we have and the missions that we have here at the Health Sciences Center. So again, our invaluable contributions of today's awardees really serve as an inspiration to all of us here at UNM and beyond. So very excited to celebrate each of them. So what we'll have is we'll have our the nominators introduce the awardee, and then we have asked each of the awardees to give a few minutes to share with us about their journey to becoming, their journey that brought them here, and then how they would like to continue serving the AAPI communities within the health and health sciences and the community, and what the award means to them. And then after that, and after they're sharing that with us, then we will certainly open the floor to anyone who would like to say any other words as well. So we'll begin with Montoya and our first awardee, Dr. Lee. Thank you.
Thank you so much, Dr. Romero-Leggett. This is really, I feel very honored to be here today and to be able to talk about Dr. John Wang Lee, who is a tenured faculty member, researcher here at the College of Nursing. She's been with the College of Nursing since 2002, and she has been engaged in a lot of different community projects. Her most recent research that she is going to be publishing on is really a response to anti-Asian racism that was fueled by COVID-19. So we are looking forward as she gets this, starts looking at the data, the quantitative and qualitative data that she's been doing and get the results done. But really what she has been is she has really been committed to the Asian health patterns for prevention of different health issues. And it's been particularly among Asian women, and has done some research in there and has published on that, which is really about their patterns of prevention, seeking behaviors, which is really important so that we know that we get these people in early enough to prevent something more tragic. Also, she's now working on a project with college students assessing the relative importance of cognitive and affective components of attitudes in predicting intention to obtain cervical cancer screenings. So this is really a lot of what she does is prevention and making sure that people know what they need to get done in order to prevent these diseases. She's just been an excellent member of the College of Nursing, having been on innumerable committees, too many to list all the committees that she's been on over the years. But I would think the ones that I like the most is that she was on the AF&T committee. She's been on the holistic undergraduate admissions committee. She chaired the graduate and professional program committee. She's been on this UNM Senate graduate and professional committee, and she's always ready to volunteer. She's very quiet, but she does so much that you don't know until you start reading her CV. Or in this case, she's going to be on sabbatical for the next 6 months. And her package was probably one of the best packages I've ever seen. It was just really good. She while on sabbatical, where she's working on her research, she's still gonna work with some of the committees. So I will just turn it over to Dr. Lee, to John Wong Lee, and just tell her how much I appreciate her colleagues appreciate her, and the health sciences appreciates what she does.
Thank you, Dr. Dean Montoya, and congratulations, Dr. Lee. We'll turn it over to you. Thank you.
Oh, thank you, Dean Montoya. I really appreciate it, all the, what you said, what I have accomplished. I really appreciate that. Yes, I tried to, address those, 3 questions that I got, through email. As you said, Dr. Montoya said, Dean Montoya said, I'm quiet, but I prefer to listen more than speaking. That's what I usually do. But, my journey becoming a health profession, began more than 30 years ago when I chose nursing as my profession. At the time, I tried to look at something that I can make an impact, whether that's large or small. And since then, my path has been filled with lots of, challenges, at the same time, opportunities. And of course, each, shaping my growth, both personally as well as professionally. Especially, becoming a nurse researcher and educator is more than just an opportunity to educate or train or nurture the next generation of nurses in the state of New Mexico. Actually, it gives me a unique, sense of identity, who I am, that is, consistent with my core values and goals. I'm very grateful for my nursing profession, and I hope to instill, in my student, how rewarding this career can be in their lives. And in fact, I have, several nieces, and 6 of them are nurses in Korea. Just want to let you know how I am crazy about being a nurse. They really enjoy, being a nurse, and they are very proud of, who they are, what they are doing. And I hope to, continue to serve the AAPI community, not only at the UNM HSC level, and also at the same time, the community level at large. I have been putting a lot of emphasis on community-based research, focusing on Asian American and immigrant. Actually, I really like this approach because it allows me to better understand and also address their issues from their insider perspective. And especially like, academia and community partnership also can ensure my research findings are, appropriate and also impactful for our community. Especially the reason why I really like this kind of approach, for my research is that it empowers my community. So they can address, their issue that directly affect them. And also it facilitate, the dissemination of my finding to the broader publics. Currently, I'm working as, Dr. Montoya, Dean Montoya said that I'm currently working with our community partner as well as the community members to tackle down some urgent issues like anti-Asian racism and its impact on their mental health. It's very serious, above and beyond what I have thought. Although very often, we are a very small segment of population in the state of New Mexico. People often, jump into the conclusion we have less instance than, what we have seen in other states. But my data tells me, other way, otherwise. So I'm looking for, look at that data. And throughout this kind of ongoing collaboration with our community partner, I really want to bring some, resources. I'm not talking about just resources sitting someplace, waiting for people to come in. Really, something is, mobilizable, enable. Something is they can access without fear and concern. So I really want to bring that kind of resources and also create, some support network. And the other thing is I really want to reestablish, their sense of belonging within their community. I think that was gone during the pandemic. I think it's going to take time to rebuild. They belong to this community. I really want to feel them. This is a part of their community. But I think we lost that kind of feeling while we are going through the pandemic. This award means a great deal to me. It's incredibly rewarding to be recognized for serving our community. But I see this award as like a call to action. So it encouraging me to further contribute to building our community, our AAPI community's strength, and also promoting some equal empowerment for our own underserved members, and also fostering greater inclusiveness in our society. Yeah, thank you. Thank you so much.
Thank you so much, Dr. Lee, and for Dr. Dean Montoya for your nomination, and Dr. Lee for sharing your story and the work that you're doing. And I really appreciate, as you said, about empowerment of the community, and just again the depth and breadth and the findings, right, and how important that is. And as you said, maybe a smaller population in New Mexico, but so critically important for us. So thank you for your work or for being part of our community. And if anyone else would like to say a few words, I'll just open the floor for a few minutes here. And I see many things in the chat. So just lots of congratulations there for your work, and congratulations to you. So I am going, yeah. Was anyone else going to say anything?
Oh, I just want to say one thing. I love to bring my own food when there is a community event. So I share a lot of time, and then I won 2 times. My Korean food was one of the most popular food. So I'm going to bring again next time. Yes.
Oh,
I am so glad you shared that, because now I know who I want to go to lunch with.
Yes, yes. Actually, I think food connects people very easily. I think, yeah, I can open my, it's like a, talking point, I can approach to people without wall. So I love to bring some, food, or even set aside my time to share my food. Yes, thank you.
How wonderful. I know, darn, if we had been in person, we could have been partaking and enjoying, but next time. And thank you for sharing that. And food really does bring us together. Thank you. Okay, so we're on to our next awardee, Dr. Sud. And I know that Dr. Lana Melendez-Groves nominated, and I know she wasn't sure if she'd be able to join. I don't see her on right now, so I'll read from her nomination to introduce you, Dr. Sud, and then we will continue with hearing from you as well. So Dr. Sood is our distinguished professor and Regents Professor and Miners Colfax Medical Center Endowed Chair in mining-related lung diseases, and serves as the interim director right now for the HSC Faculty Academic Affairs. So Dr. Melendez-Gross said, I'm honored to nominate Dr. Sood, who has excelled in research, education, and DEI in support of the AAPI community at UNM Health Sciences. He provides healthcare to disadvantaged rural communities in New Mexico, drawing from his clinical experience in remote villages in India. During the pandemic, he published on anti-Asian hatred as a career challenge among faculty mentees, which was also the topic of his JEDI article for the Department of Internal Medicine newsletter. He is passionate for increasing AAPI representation in UNM research. He enrolled 49 AAPI faculty in an organizational mentoring climate survey, 66 in exit interviews, and 22 in mentor development clinical trials. And he promotes research equity for AAPI communities on NIH's Diversity Program Consortium Executive Steering Committee. 5 of his AAPI students at UNMHSC have presented their research at the premier American Thoracic Society International Conference, including the recipient of the 2019 Department of Internal Medicine Resident Excellence in Research and Scholarly Activity Award, which was Pael Sen. And his AAPI faculty mentees here at the Health Sciences have evolved into NIH-funded investigators with Dr. Lang and Dr. Asaf, and lead academic programs, Dr. Assad as well. So very excited about and appreciative of all that Dr. Sood brings to us. And last, I think it was in May of 2022, he served as director of the AAPI Heritage Month celebration, where he brought in Dean Chatterjee's talk that was titled Finding, Selecting, and Taking on Leadership Roles in Academic Societies, Lessons for Asian American Pacific Islander Faculty. And as Lana says, Dr. Sood's contributions make him an outstanding candidate for the UNMHSC Office for DEI Excellence Award during AAPI Heritage Month. Congratulations, Dr. Sood, as well deserved, and I'll turn it over to you. Thank you.
Well, thank you, Lana in absentia, and thank you, Dr. Romero-Leggett, for reading out those wonderful words. And thank you to the Office for DEI for honoring me with this Excellence Award during the AAPI Heritage Month. I was born in India to a family of modest means. My father died from a stroke when he was 50 years old, partly related to poor healthcare. I promised my dying father that I would be a physician one day and take care of poor, disadvantaged people. I chose to study medicine in the US, and like most immigrants, I vividly recall my first day in America. But it wasn't about the high quality infrastructure, or the variety of cars, or the diversity of people, or the sense of freedom. What struck me most was clean air, as opposed to New Delhi smog that I was used to. I soon learned my first American lesson. Not all Americans are exposed to clean air. Occupational dust and household wood smoke impact the air quality in many American communities. As a resident, I learned my second American lesson, the key role of mentorship for trainees. My mentor during my residency opened doors and opportunities for me and helped me get a fellowship in pulmonary medicine at Yale University. I distinctly remember my first day at Yale. All the new fellows were discussing knockout mice on the conference table. The term knockout mice refers to mice with specific genes that are artificially deleted. I remember asking myself, why do mice knock each other out? I'd never been exposed to knockout mice during my training. I was sure I did not belong to Yale and was admitted by mistake. My third American lesson was that imposter syndrome is common in learners of color. During my fellowship, my program director told me I needed to create a niche. That was my fourth lesson, which I give to all my trainees. Create your own niche. In my case, my niche turned out to be occupational lung disease. I started my academic life at Southern Illinois University School of Medicine in Springfield, Illinois, a much smaller academic institution with fewer resources than the University of New Mexico. On my first day there, I called my mentors. I told them there was not very much out here. I got my fifth lesson, which I continue to share with my mentees. Make the most of what you have. Every place has its own local strengths. Once I came to the University of New Mexico, I made the most of this place's local strengths, which included the Clinical Translational Science Center and the diverse communities in the state. I strengthened the collaboration with Miners Colfax Medical Center to care for rural workers with occupational lung disease, who are almost always minorities. This work rewarded me with an endowed chair. My sixth lesson: that poor but determined communities can demand substantial change and will collect money to fund that change. I've supported UNM RP communities through research, education, and DEI initiative. As Lana mentioned, during the pandemic, our team published on anti-Asian hatred, but it wasn't in mines. This was really at universities. And our work allowed me to advocate for unique challenges that RP faculty, staff, and learners face. I'm passionate about increasing RP representation research, both as research participants as well as researchers. I continue to promote research equity for RP communities on the NIH Diversity Program Consortium Executive Steering Committee. You cannot promote research equity until you increase RP participation as independent researchers. I'd like to say I approach my work with RP communities and this award that you've been so kind to give me with a frame of respect, honesty, and humility. I recognize that the value placed on diversity, equity, inclusion, and accessibility by the award improves the inclusive climate of the university that we all love. I'm also happy that I can fulfill my promise to my late father of working with disadvantaged communities, and I thank the HSC Office for DEI for this honor.
Thank you, Dr. Sood, again, and for sharing that story. Just so much appreciate. And as you said, as you go along and the lessons learned and what you shared with all of us here today and some of those lessons, as well as all of those that you've mentored over the years and the work that you've done. And I'd like to open it up to others who would, if anyone would like to say any remarks at this point. And I know we have several things and congratulations in the chat as well.
Thank you.
And even if you put things in the chat, you can say something out loud too. So please feel free to add anything you'd like.
I would like to add, Dr. Sood is always my go-to person. He's always my go-to person because we always have, he's so good. He's so calm when I'm like at my last end, and he just helps me calm down. Let's think how this is going to do. We'll help you get through it. And I think also that the work that he does with doing exit interviews and trying to understand how we can keep more of our faculty here. And he's always got the best interests of faculty, always.
Thank you.
Well, Dr. Sood and I came from the KL2 scholars. We were like the first guinea pig class of the CTSC scholars. He's always amazing. I've always been impressed, so eloquent. And I'm thinking, am I going after him? Dang it. So Akshay, congratulations, well-deserved. Yeah, it's wonderful to see all that you've done. You are so successful. And I have to say, he gives the best advice. So anything, whenever I run into him, gives the best advice. Even for my father, when he said, no, it's not the pulmonary person you need to go, it's a pulmonary hypertension specialist, which I actually didn't even know that existed in the adult world. So thank you for that.
Thanks.
Thank you all for sharing, and give a couple minutes more. And Gina, thank you for joining us as well today, and others who have joined in the last several minutes. Okay, and seeing again more in the chat, we'll continue on with our third awardee. And then Berta, as you said, you were saying, oh shoot, darn it, I have to follow Dr. Sood and Dr. Lee here. So, but again, we are just so thrilled and really very appreciative of all of our awardees today. And I love just being able to share stories with each other and, you know, accomplishments and stories, and have the opportunity to celebrate, because this is just a really wonderful time. I think very special time for all of us. So Dr. Kong, who I have known for many, many, many years, back in our days of always working with adolescents and in the school-based health centers, and I put forth her nomination along with the Asian American Pacific Islander Medical Student Association. So I will now introduce Dr. Kong. She is a professor of pediatrics with a subspecialty boarded in adolescent medicine at UNM School of Medicine, and her primary appointment is in Department of Peds, with a secondary appointment in our Department of Family and Community Medicine, and really has dedicated, Dr. Kong has dedicated over 2 decades to advancing child and adolescent healthcare. She currently serves as the interim vice chair of research in Peds, the chief of the Division of Adolescent Medicine, and director of Envision New Mexico, and really has been instrumental in improving healthcare quality and outcomes for young people in our state. Dr. Kong's career is marked by significant contributions to research with continuous NIH funding since joining the faculty in 2006. I just remember you were right out there in research, and the rest of us were just learning from you all of these years. And has earned numerous awards, such as our HSC Faculty Research Excellence Award in Population Science. So Dr. Kong is also very committed to mentorship, as we've heard from others here today as well, and has guided numerous faculty, pediatric residents, and medical students in their research and professional development. And her dedication to improving population health is really evident so much you'll see in her work in pediatrics and adolescent medicine, where she blends clinical practice with the community engaged research, and really has contributed to understanding the STI, sexually transmitted infectious co-infections, and cervical immune microenvironments, and has been principal investigator on an NIH-funded study, really demonstrating her leadership in addressing adolescent obesity, a huge issue not only in our state, but as we know, in the nation. And her involvement in intervention studies really does underscore her commitment to advancing AAPI adolescent healthcare on a broader scale. So in support of the Asian American Pacific Islander community, Dr. Kong has co-chaired the inaugural AAPI Heritage Month here in 2021. We were so appreciative as we were really ramping up and starting to develop all of our Heritage Month activities. And she did this also because a part of the thing that drove her at the time was witnessing the growing incidence of anti-Asian violence that surged during the COVID-19 pandemic. And really, she felt a need at that time to bring the awareness and discuss those challenges that were being faced by the AAPI community. And Dr. Kong continues to support AAPI students because she's the advisor and serves as advisor for our inaugural Asian Pacific American Medical Student Association, APAMSA, and always dedicated to providing a safe space where students can connect with someone who understands their experiences, culture, and identities. So again, please join me in congratulating, and Britta, just really so appreciative of everything that you've done over the years, and being a colleague with you as well. So thank you and congratulations.
Thank you, Dr. Romero-Leggett. I've known Valerie since I was a resident. That's how long it's been, and I still remember her when we used to have picnics and volleyball games way back then. She is the same person she was then, just always wonderful and easy to get along with, easy to approach. So I really do appreciate all the work you've done. And it's been, you know, just wonderful seeing you excel here too. I do want to thank Dr. Lee and Dr. Sood for their work addressing anti-Asian hate. Dr. Lee, I will be contacting you about the food. I love Korean food. And again, it's great to be honored with Dr. Sood, who again was my KL2 scholar peer. And again, just a wonderful human being. I've enjoyed, Akshay, our decades of running into each other at our children's school events. I'm deeply honored to receive the UNM Health Sciences Office of Diversity, Equity, and Inclusion Excellence Award for Asian American and Pacific Islander Heritage Month. This recognition means a great deal to me, and I'm grateful for the opportunity to share my journey and aspirations with you today. So my journey of becoming a physician began at a very young age, shaped by my family's immigration story and my early experiences. The Immigration and Nationality Act of 1965, which eliminated the national origins quota system and abolished the Asian exclusion laws, provided my parents the opportunity to immigrate to the United States from Hong Kong in pursuit of the American dream. Because the act established a new system that gave preference to skills-based immigration, my mother, who was a nurse, was the first to immigrate from Hong Kong. My father followed after a year, as the act also gave preference to family reunification for spouses. I remained in Hong Kong, raised by my grandparents. My grandfather, an Eastern healer and herbalist, practiced his craft in our flat. And his dedication and compassion for his patients profoundly influenced me. Watching him care for others ignited my passion for science and the desire to help those in need. So when I was nearly 7, my parents moved me to America, where I continued to be really inspired by my mother. Watching her go sometimes at night when she was called for the operating room, she was an OR nurse, and then witnessing her quick action and skill when 2 elderly gentlemen collapsed in a restaurant left a lasting impression on me. I vividly remember one incident where another nurse stood by passively while my mother performed mouth-to-mouth resuscitation until the paramedics arrived. And despite her life-saving actions, my mother did not receive the recognition she deserved. A moment that underscored the challenges and differential treatment we sometimes face as Asians in our community. These experiences, both inspiring and challenging, shaped my determination to pursue a career in medicine with an interest in working with diverse and underrepresented populations. I went on to earn a Bachelor of Science in General Biology, followed by a medical degree from the University of Arizona College of Medicine. My education continued with a Master's of Public Health from the University of New Mexico, focusing on community and preventive health. And throughout my training, including an internship and residency in pediatrics here at the University of New Mexico and a fellowship in adolescent medicine, I became deeply committed to advancing equitable health care for children and adolescents, particularly in underserved areas. Over the years, I've been fortunate to serve in various roles at UNM, including the interim vice chair of research in pediatrics, where I had the opportunity to engage diverse populations who are typically underrepresented in research, chief of the Division of Adolescent Medicine, where our team provide quality clinical care through accessible school-based health centers, and director of Envision New Mexico 2.0, the initiative for child healthcare quality, where we work with medical specialists to bring best practices to our rural communities in high priority areas. As a health professional, I recognize the importance of representation and advocacy for the AAPI community. Co-chairing the inaugural AAPI Heritage Month at UNM-HSC in 2021 was a pivotal moment for me, as it allowed me to address the growing incidence of anti-Asian violence during the COVID-19 pandemic and bring awareness to the challenges faced by the AAPI community. I recognize when Dr. Lee had said she'd rather be in the background and not talk. I am very similar too. But I think this was a time where I felt like I needed to speak up. And I was really inspired, honestly, by my younger peers. I remember Joyce Peng, one of the residents, surgical residents, and their bravery for, not being afraid to speak out. And looking forward, I hope to continue serving the AAPI community by fostering a supportive environment for AAPI students and professionals at UNM. As an advisor for the Asian Pacific American Medical Student Association, I'm dedicated to providing a safe space where AAPI students can connect with mentors who understand their experiences. Additionally, I aim to advocate for policies, initiatives that promote equity and inclusion within the broader community. So receiving this award is a profound honor. It signifies recognition of the efforts to promote diversity, equity, and inclusion, not just within the AAPI community, but for all underrepresented groups. This award reinforces my commitment to continue working towards a more inclusive and equitable healthcare environment. It is also a testament to the collective efforts of my colleagues, students, and the UNM community who have supported and collaborated with me throughout my career. Together, we have made strides in improving healthcare quality and outcomes for young people and advancing research that addresses health disparities. So in conclusion, I'm deeply grateful for this award and the opportunity to share my journey. My mother, who passed away last year after a year-long battle with multiple myeloma, I was going to not try to cry at that part, would be very proud and also very surprised, as I was when I heard about this on Tuesday. I look forward to continuing my work. In serving our community. So thank you again.
Berta, thank you so, so much. And we all know, well, I'm over here getting teary-eyed myself, but we know that your mother always was so very proud of you and is watching over now and is still continues to be so proud of you. So as we all are. So thank you for that and sharing your journey and your story. And again, just really appreciate these opportunities to learn more about each other as we celebrate all of your amazing work. But I'd please like to open the floor for others who might want to say a few words. For Dr. Kong now, or again, open for the floor for the Heritage Month's awards. Thank you.
I'd like to congratulate all the awardees. And I think the theme that everybody has is their passion to improve communities based on your own personal life experiences, which I think very much for people is our why. Why do we do what we do? And it just shows so immensely that passion in all the work you do and the success you all have had in this great work that you do. I'm Loretta Cordova-Ortega. I'm chair of the Department of Pediatrics, and Dr. Kong, I got to know her when she started here as a resident. And with great pride, I can see that the incredible work that she's done and very humble about her success. Dr. Kong was one of the first KL2 scholars and the first one to get an R21 and then go on to get an R01 and has had incredible success with NIH funding and now works just tirelessly in that field of research, but really has a national recognition. The other thing I want to call out is that she is the only board-certified adolescent medicine doctor in the state of New Mexico. And when you have somebody carrying that on their shoulders, you would think that it would be a challenge and difficult, but I see Dr. Kong every day when we meet and she says, let's keep going. This is what we need to do. This is how we do this. And I think that it is just so wonderful that we can tell the story of unsung heroes and all of you, but just the quiet, passive way you do work without really recognized, but the incredible impact that you have both locally and nationally is really something to be greatly commended. And so I just wanted to say that today.
Thank you so much.
This is Sylvia Negrete, and I just wanted to just say a few words to Berta about how I felt that she was incredibly helpful as a clinician. I did not have research experience, and at one point, I took on a fairly large research project from a faculty who was leaving, and I accepted it. I did not know what I was doing, and I and it was like I didn't know the language, and she just was there. She supported me, and she said, Sylvia, you know what? You need to get some training, get some IRB training, some city training, good clinician practice training, grant management training. And eventually I was able to obtain research funds for that project. So I just wanted to thank you, Berta. Like, you had no idea that I had no idea what you guys were all talking about. And at the national level later on, we traveled to meetings and she taught me the language, the very exclusive language that is used in research. And so that I was able to collaborate with a very large research group. So I wanted to thank you for that, because you were there. You did not know how much you did, but I did not understand what everybody was talking about as a clinician. And then more and on a personal level, I wanted to thank you for your friendship. You have always worked really hard, even when your mom was going through all that stuff. I could not believe you were still answering emails. And I cried with you. She also, during pandemic, taught me that eating salmon is good. And she actually brought salmon to my home and dropped it off for my family. I love you, Berta. Take care.
Oh, now I'm gonna cry more.
Yes, we're all going to be bawling here at the end. Good tears, tears of joy and happiness and just appreciation. Any other people would like to just make any comments about our awardees, about our Heritage Months, anything that is
So,
moving you today?
Dr. Romero-Leggett, I'm gonna need to leave as I have to trip off. But I just want to thank you for organizing this and all the work that you do for DEI. And we wouldn't be doing these without you. So thank you so much.
Well, thank you, Dean Montoya. And on that note as well, deep gratitude to Amaris Swan, because none of this would be happening without Amaris, who has been our constant through multiple leadership changes and making sure that we are organized, that things are happening, that the community knows, and coming up with some great ideas. So Amaris, thank you so much. And as we know, all of these are so collective of efforts, and just really appreciation to our entire team as well. So thank you, Dean Montoya, for your kind words and for your nomination and joining us. But any others who would like to say any words today before we head out? Oh, and then Akshay, please.
I just wanted to say a few words. I wanted to tell Berta that one of her greatest legacies to AAPI is raising a beautiful AAPI family. Her husband, who works at Sandia National Laboratories, her daughter who plays softball and is graduating from college, and a son who wants to serve the country as Coast Guard. 10 years ago, Berta and I were talking in front of the elevator. She told me she had worked long enough at the University of New Mexico to retire. I just want to tell you that I'm so grateful that you have not retired over the last 10 years and for all the wonderful work that you've done, even though you could have retired. Thank you, Berta, for all that you did.
Dr. Romero-Leggett, I also want to thank you and Dr. Swan for bringing us together. I'm reflecting back to when we commenced all of the Heritage Month celebrations, and I was so privileged to serve alongside Dr. Kong. You are an incredible leader. I realized at that point that the Heritage Months are critically important, but that we have so many jewels across UNM Health Sciences. And I'm grateful to have served alongside you, and you're so deserving of this honor. Dr. Sood, I remember the very first time that we met alongside Dr. Rakel with the Department of Family and Community Medicine. You addressed mentoring and the importance of really supporting one another through mentorship initiatives. And you continue to inspire me through your brilliance and your compassion. And you just are a tremendous model for all of us. And Dr. Lee, thank you for your commitment and passion. We appreciate all that you're undertaking to serve our communities. And we're grateful to everyone for the service that they provide for our communities. And to each and every one of you, I congratulate you for your achievements.
I would also like to congratulate everybody. and also to thank Valerie for this opportunity, because again, this is, although again, I see Dr. Kong and Dr. Sood often, it's wonderful to hear from them at a platform like this. So congratulations to everybody.
Thank you all so much. And I know we still have a little bit of time if anyone else would like to share and offer any words. We have a lot of wonderful, beautiful things in the chat. So thank you for that. And I would like to also just let people know that when we were talking about this month, the Heritage Month for AAPI now, we were discussing, Amherst and I and Dr. Smart, and Dr. Smart, who, as you all know, has the book club that we do for the HSC, and so decided to actually pick a book for AAPI and Heritage Month, and we're going to try to do something like this moving forward. And we did purchase some of the books in the office for people to please come and pick up. And I should have looked this up here before I started talking, but Amherst, do you recall the name of the book title this year, or anyone from our office? We were just talking about it yesterday, and I love the idea to really just again have these, you know, side by side and do another very a related book for Heritage Months. Do you have that by chance?
Yes, and I also dropped it in the chat, the flyer for the event. It's Minor Feelings: An Asian American Reckoning by Kathy Park Hong. So that'll be the book that you can sign up for. We have 20 copies available, so the first 20 people can get a book, and then Dr. Smart will also be available to open conversations, to have conversations related to the topic. So
yes, well, thank you, Amherst and Dr. Smart. And I just thought, like, what a great idea, and like just new things. So as you all have ideas, the other thing we'll be doing too, and then speaking about the cultural aspect that Dr. Lee was bringing up too as part of it, is we want to start, as many of you will remember who have been here a while, some of the cultural events, right? And some different things that we do that happen in many of the Heritage Months, but we want to make sure that we have always our excellence awards. We have, you know, some academic and, you know, very scholarly presentations, important community presentations, and then some of the fun, you know, come together as a community cultural events too. So if you all have ideas moving forward and you'd like to be part of any of that, we'll be putting together a small committee. And again, you don't have to serve like, oh, the whole year, all the Heritage Months, but if you have a certain one you'd like to participate in, like Berta did back in 2021 with AAPI, that would be amazing. But again, I just leave like these days so filled with gratitude and just like a more appreciation again for all of you and the people that work here and our colleagues. And I love sharing our stories and celebrating, and I appreciate that you all joined us to do this. And again, congratulations to our amazing Dr. Sood and Dr. Lee and Dr. Kong, because really, I mean, when we were talking today about the theme, right, for this year about advancing leaders through innovation, you all have done that consistently over so much time. And I appreciated so many of the comments today, and again about the idea, yes, you know what, all these awards bring out the unsung heroes, absolutely, as you said, Loretta. And just, I think one other theme that I heard throughout again is like, you all continue to open doors for those who follow, and you also bring along your colleagues and people here, and all in service to communities. And again, the why and the things that drive you is just really beautiful to learn and to celebrate. So again, really appreciate all of you joining and being able to celebrate here for our Health Sciences Center Office for Diversity, Equity, and Inclusion Excellence Award for Asian American Pacific Islander Heritage Month. So thank you all from the bottom of my heart, and all of us from our office. We really appreciate this and made our day. Oh my gosh, like I'm like lifted now. I'm like so happy. Yes, this is going to keep me for the week at least. Oh, tomorrow's Friday. Okay, that's going to keep me going for a while. So thank you. And any last comments before we sign ourselves out here? Okay, congratulations again. And thank you everyone for joining. Really appreciate it.